Hello, Ranch Cordova residents and businesses. I'm City Council Member David Sander. In addition to being a council member, I am also a virologist, which is a scientist who specializes in the study of viruses. Your city has been here to support you throughout the COVID-19 pandemic. Vaccination rates continue to increase, but we are still seeing COVID-19 cases, and the vast majority of those are among those who are not vaccinated. And now, a new COVID-19 variant called the Omicron variant has been discovered. You've probably heard about it. It's a sober reminder that COVID-19 is not over. Today, we want to provide you with what we know about the new variant, as well as what you can do to continue to stay safe. Variants of COVID-19 are mutations in the SARS-CoV-2 virus that causes COVID-19. These mutations are normal for viruses, and they will continue to happen as long as the virus is infecting people. The more people that are infected, the more likely that a new variant will occur. That's just how viruses work. The World Health Organization has classified the COVID-19 Omicron variant as a variant of concern. Now, that means it appears to spread more easily than other variants, and therefore they're paying a little more attention to it. According to the Centers for Disease Control, or the CDC, one case of this variant has been identified in our country, in San Francisco, as a matter of fact. As we saw with the Delta variant, and in my opinion as a virologist, almost certainly this variant will spread through the US at some point, if it is better at infecting people than other variants. That's how viruses work. As a precaution, air travel restrictions have been put in place from South Africa, where this variant was first detected, and 7 other African countries. The CDC is working with public health partners and scientists from around the world to find out more about this variant, and we will likely have more news soon. But this is not a time to panic. This is a time to ensure that you're protecting yourself and those around you. If people are not vaccinated, they are 5 times as likely to be infected by the virus and 29 times more likely to be hospitalized with serious COVID-19 disease. These infections give the virus an opportunity to replicate and mutate, which is what caused the Omicron and Delta variants. The more people that are infected, the more variants we see. Now, you might be asking, why have people who have been vaccinated, why are they still getting COVID-19? Well, COVID-19's vaccines are effective at preventing infection, serious illness, and death. But by far the most people who get COVID-19 are unvaccinated. Vaccines are like fire extinguishers. They don't stop the fire from starting, but they do put out the fire. They train your immune system to fight the virus, so that whenever you get infected, a minor infection, your immune system is ready to fight that virus. That's how vaccines work. However, since vaccines are not 100% effective at preventing infection, some people who are fully vaccinated will still get symptoms of COVID-19. But importantly, these people are getting less severe symptoms and are far less likely to be hospitalized or die. We've been getting vaccines for a long time in this country to protect us against illnesses and diseases. Vaccines for smallpox led to the eradication of that disease in its entirety from the world. Polio is nearly eradicated worldwide because of vaccine use. We've used vaccines to save millions of lives from what used to be common diseases like measles, mumps, whooping cough, rubella, tetanus, diphtheria, among many others. Number 1, get vaccinated or get a booster shot if you've already been vaccinated. Number 2, wear a mask indoors, or if you are around people who aren't your family members or who may be unvaccinated or vulnerable to infection. I know you are probably tired of wearing masks, and believe me, so am I. But on top of being vaccinated, masks protect both you and others from airborne droplets, which is how this virus spreads, especially in situations where you don't know if others around you are vaccinated. Number 3, practice social distancing in public spaces. Again, especially in situations where you don't know if the others around you are vaccinated. Number 4, hold gatherings outdoors. Gatherings have been a source of outbreaks since this pandemic began, and as we head into the holiday season, this is even more important. And number 5, practice good hygiene. Wash your hands, use hand sanitizer. You know that drill. Vaccines and boosters are widely available and free. Anyone 5 years or older can receive a Pfizer vaccine, and anyone 18 years or older can receive the Moderna and Johnson & Johnson vaccines. Studies show that after getting vaccinated, antibodies slowly decline in your body over a period of months. This is normal. It happens in all infections. Booster shots provide you with an additional protection against COVID-19 and boost your antibodies to a higher level. These high levels may even protect you from getting a mild case of COVID-19. The COVID-19 vaccine booster shots are approved for everyone 18 years and older who either received the second shot of a Pfizer vaccine or Moderna vaccine at least 6 months ago, or received the Johnson & Johnson vaccine at least 2 months ago. Plus, you can get a booster shot of any of the 3 COVID-19 vaccines. For example, if you got the Pfizer vaccine, you could now get a booster shot of the Moderna vaccine. If you think you have COVID-19 or were exposed to someone who has COVID-19, get tested. Free walk-in testing is available around our county and on Tuesdays at our Cordova Neighborhood Church right here in Ranch Cordova on Coloma Road. For vaccine and booster locations, testing information, and additional questions, visit the city's coronavirus webpage or call City Hall if you don't have access to a computer. Before I sign off, I want to leave you with one closing thought. The holiday season is a time for us to inspire and care for one another, practice gratitude, and be hopeful for what is to come. Let's take the spirit of the season to heart and continue to work together to protect our community from COVID-19. Thank you, happy holidays, and Merry Christmas.